Hello everyone, this is a new episode of our playlist related to MRCS examinations part B. We have to discuss today about the abdominal examinations. We have our frame as we discussed before. Firstly, wash your hands, introduce yourself and confirm patient details, explain the examinations, and gain the consent and ask for the chaperone and also the exposure. But we have a note in this related to the exposures and also ask for about pain. After that, we go for the core of abdominal examination, general inspection, and after that, palpate the abdomen, and after that, percuss the abdomen, auscultate the abdomen, and thank the patient and wash your hands. And there is a new note related to special test to some cases. Okay, we have to discuss by more details. Okay. Firstly, after introducing the room, wash your hands carefully. After that, introduce yourself. Good morning. My name is Dr. Hamza. I am one of the surgical doctors here. Confirm patient details. Could you please confirm for me your name and age? And after that, explain the examinations. Today, you have been asked to examine your abdomen. This is well involved, looking from the end of the bed, feeling various area of the abdomen, and then listening at the end. And after that, we have to gain the consent. Was that okay with you? And also ask the chaperone, the examiner with you as the chaperone. After that, we have to exposure. We have to postpone this to this step to be more comfortable with the patient. Okay. After that, we have to ask about the pain before start the core examination. Do you have any pain at the moment? Okay, after that, we go for the inspection. General inspections from the end of the bed. Could you please cough for me? Could you please raise your head up? Okay, and look for the body habitus, look for the scars, look for jaundice, look for abdominal distensions, any masses, and after that go to inspect the hand. Inspect the hand firstly by dorsum and palmar and clubbing and capillary refill and asterixis. And take care about colonychia, take care about palmar erythema, Dupuytren contracture, and also clubbing by Shamroth window test and asterixis if there is related to hepatic encephalopathy, uremia, or something like this. Okay. After that, we have to go to inspect the eyes, the thelidma, which related to hyperlipidemia, conjunctival barrel related to anemia, jaundice related to raise of bilirubin, hyperbilirubinemia. Okay. And after that, we can look for the mouth. Look for the mouth for angular stomatitis, oral candidiasis, mouth ulcers, glossitis. Okay, could you please open your mouth for me? And could you please raise your tongue to the roof of the mouth? Okay. And by the way, we have to inspect the axilla and the trunk. And at these points, you have to ask about the exposure by polite way. Could you please expose your abdomen for me to inspect your axilla and the trunk? This is the perfect way. And after that, we have to inspect the lymph node in the neck. Okay. I would like to examine any glands in the neck which related to the important one, left supraclavicular lymph node. Left supraclavicular lymph node, which associated with gastric malignancy, by the way, and named by Berkow's lymph node. After that, we have to inspect the chest, notice any spider nevi, any gynecomastia, and adjust the position of the patient by asking the patient to be supine on the examination couch. After that, inspect the abdomen and go to palpate the abdomen by superficial way and deep way. By superficial way, light palpations assess each across each 9 regions by way manner, okay, and notice any abdominal gardening or masses. Monitor the patient faces for any discomfort or tender or something like this, and again with the deep by deep way is shaped by deep palpations, and also palpate the liver, palpate the spleen, palpate the kidney, palpate also the aorta for any pulsating masses suggest any aortic aneurysm or something like this. After that, we have to percut the liver, percut the spleen, splenomegaly, suprapubic bladder for urinary retention or something like this, and shifting dullness, which is important and famous one in the abdominal examination. In the percussion of the abdominal examination, shifting dullness related to the ascites. After that, we have to auscultate the abdomen, any bowel sounds, any aortic puree, any renal artery puree, and finally, we have to thank the patient and wash your hands. And take care to ask the patient to examine the genitalia by direct rectal examination, okay? And after that, in the abdominal examinations, we have to doing some special tests related to the case of appendicitis, the case of acute cholecystitis. Appendicitis, it's rebound tenderness, it's a Sarvin sign, obturator sign, Sow's sign. You have to take care to see videos related to this tests, which is important to doing it if the case related to appendicitis. You have to cover all this. And the acute cholecystitis, it's more signs. That's all, and thanks for your listening.